Welcome to Critical Health News' weekly video Bright Bite with pharmacist Ben Fuchs.
Ben, we've been getting a lot of letters about PCOS. What can you tell us about it? I've never heard of it personally, so give us a little primer here.
PCOS stands for Polycystic Ovarian Syndrome, and it's a condition where women will grow lots of cysts, polycysts, many cysts in the ovaries, and it's associated with a lot of symptoms. The syndrome is a condition that has lots of symptoms associated with it. So Polycystic Ovarian Syndrome is most notably associated with growth cysts in the ovaries, but it's also associated with things like thinning hair, menstrual problems, weight gain, body hair or facial hair, thyroid problems, etc. So it's a syndrome that is most classically marked by lots of cysts in the ovaries. Now here's the thing. Whenever you hear about a growth condition, polycysts means a growth condition, you want to think of two major factors. Number one, blood sugar and insulin, and number two, the hormone estrogen. And likewise with polycystic ovarian syndrome, you basically have an estrogen condition or a problem with estrogen, and you have a problem associated with blood sugar or insulin. In fact, a lot of folks will consider PCOS to be a pre-diabetic or a diabetic condition. So therein lies the clue to dealing with PCOS. Now, you don't have to be diagnosed with it. You don't have to be diagnosed with cysts in the ovaries. You don't have to be diagnosed with diabetes or blood sugar issues. If you find that you've got problems with your menstrual cycle, so-called dysmenorrhea or PMS, or your periods are irregular or they're heavy, or you have problems with weight gain, skin problems, oily skin, breakouts, thinning hair, hair loss, all of these, if you have any of these symptoms, you can pretty much assume that you're dealing with PCOS, polycystic ovarian syndrome. Of course, if you're diagnosed with lots of cysts, then you're definitely a PCOS patient. What do? First of all, focus on blood sugar. In fact, if you want to think of one thing to do for overall health and longevity, focus on blood sugar. There are lots of ways to do that. The easiest way is to reduce your intake of sugar. By reducing the amount of sugar that you eat, you're going to lower your blood sugar, and that's obviously the best way to take care of blood sugar issues, whether you're diagnosed as a diabetic or not. Just for plain old longevity, reducing your intake of sugar and lowering your blood sugar is a great strategy. You can also use nutritional supplements that help your body process sugar. Chromium and Vanadium, the SweetEze, for example, two classic minerals that are associated with helping the body process sugar. The B vitamins, especially vitamins B1 and B3, thiamine and niacin, are associated with better sugar control. Drinking water after you eat sugar is another wonderful strategy for helping your body deal with high blood sugar. The mineral magnesium is also associated with lowering blood sugar. Selenium can help, sulfur can help. These are all nutritional strategies, nutritional supplemental strategies that will help you lower your blood sugar, and if you're dealing with PCOS, they're great tools. The next thing to do is work on estrogen, the hormone estrogen. Now, whenever you're dealing with excess estrogen, this is called estrogen dominance, whenever you're dealing with excess estrogen issues, think about using progesterone. Progesterone is the antagonistic hormone to estrogen. If you're dealing with problems with excess estrogen and obesity, weight problems, blood sugar problems, thyroid problems, hair loss, anxiety, insomnia, these are all estrogen issues. Progesterone is a wonderful, benign, mild, easy-to-use non-nutritional strategy, hormonal strategy. You can use progesterone cream. You can get a prescription for progesterone. Some people like to use wild yam, which isn't exactly progesterone, but may have some progesterone effects. So progesterone is a wonderful strategy. Using progesterone is a wonderful strategy for dealing with PCOS. You can also use a supplement called pregnenolone, which is available in health food stores. We've talked about pregnenolone in the past. Both pregnenolone, and that's Pregnenolone, pregnenolone, both pregnenolone and progesterone have a nice calming effect on the body, and they balance out estrogen's kind of anxiety-inducing or jitteriness causing effect. Pregnenolone and progesterone are also great for dealing with anxiety, insomnia, even seizure disorders. Any hyped up, amped up condition in the body, you can get some benefit from both pregnenolone and progesterone. 100 milligrams a day of pregnenolone. If you're going to use progesterone cream, look for a 10% cream. You'll have to have a compounding pharmacist make that for you. Most over-the-counter progesterone products are 1 or 2%. Maybe 50 milligrams or so, whatever the equivalent of 50 milligrams to 100 milligrams of progesterone per day is a good place to be. You can also use supplements that help with estrogen. Selenium is one of the all-time great supplements for balancing out estrogen if you're dealing with any excess estrogen symptoms, including PCOS. 100 to 200, 300, or even up to 400 micrograms a day of selenium is a good dose. Magnesium has a balancing effect on estrogen. Vitamin E and A can also have a balancing effect on estrogen. 400 international units a day of vitamin E and maybe 10 to 20,000 international units a day of vitamin A. Some doctors will feel like 20,000 IU vitamin A a day is high. I personally don't. I've been using it myself for many years, and I recommend 20,000 IU a day. Certainly 10 to 20,000, anywhere in that ballpark is a good place to deal with excessive estrogen. Iodine is one of the all-time great underappreciated minerals for dealing with estrogen issues. Most people know that iodine is important for the thyroid, but what a lot of people don't recognize is iodine is important for all the glands. The pancreas and the adrenals and the thymus all benefit from iodine supplementation, and iodine has been shown to be beneficial for symptoms of excessive estrogen, including PCOS. The B vitamins, again, also important for helping balance out estrogen, especially vitamin B5, really underappreciated B vitamin, pantothenic acid, very important for the adrenal glands, which are your stress glands, also has an important role to play in the production of hormones, including estrogen. And then there's the whole digestive link to estrogen dominance. It turns out that estrogen is processed by bile and also by good bacteria in the colon. So anything you can do to support liver health and bile, and also to support digestive health, especially around probiotics and good bacteria. In this regard, you can use probiotic supplements. You can also eat fermented foods. And then anything you do for intestinal health is going to help. There's a condition called small intestinal bacterial overgrowth, SIBO, which is associated with fructose problems with sugar metabolism. So using probiotics and supporting digestive health is one strategy for helping deal with estrogen, but also watching out for sugar intake, especially if you notice that after you eat sweet foods or breads or anything that breaks down into sugar that you're gassy or feel bloated or bloated, chances are that you're dealing with SIBO, SIBO, especially if you have PCOS and SIBO. You may want to watch out for your intake of sugars, fructose, and also starches that break down into sugar. And then last but most certainly not least is relaxing the body, calming the body by using deep breathing strategies, relaxation techniques, the ones we talk about all the time, hot showers, hot tubs, hot baths, massage, Reiki, yoga, anything you can do to relax the body is going to have a beneficial effect on any excessive estrogen symptoms, including PCOS. So your main strategies are going to be to support blood sugar. Anything you do to support blood sugar, treat yourself as if you're a diabetic, whether you're diagnosed or not. The second thing is work on digestive health. Do everything you could do to support the body's ability to process estrogen. Forgot to mention the importance of liver health, because bile helps clear out excess estrogen. So anything you can do for the liver, which is where bile is made, including using bile supplements. Digestive enzymes, for example, the Longevity Ultimate enzymes, have bile salts in them as part of their ingredients, as part of their formulation, and taking bile salts can help your body make bile, thereby improve the excretion or the elimination of excess estrogen. So anything you do for the liver and the digestive system, and of course using progesterone cream, or using pregnenolone supplements if you can't find progesterone cream, those can be beneficial. And then last but most certainly not least, making sure that you're practicing all your relaxation techniques, including the slow deep breathing, as well as yoga and hot water and meditation, Reiki, yoga, etc.
Ben, you mentioned drinking a glass of water after eating sugary food.
Lots of water. Yeah, we think about it. One of the issues with when we talk about blood sugar, we really need blood sugar concentration. That is, how much sugar is in the blood, right? So the concentration of sugar in the blood becomes high. If you drink water, you'll dilute your blood. You create more blood volume, and the amount of sugar will represent a smaller component of the blood, thereby essentially lowering your blood sugar concentration. Something as simple as drinking water. I don't know if you watch TV, but these days, almost every hour you see a commercial for some kind of anti-diabetic drug. Well, you don't need an anti-diabetic drug. You just need common sense. If you understand that what they're talking about with elevated blood sugar is elevated blood sugar concentration, you can see that by drinking more water, diluting the blood, increasing blood volume, the concentration of sugar will naturally drop. Non-toxic, no doctors, no drugs required, doesn't cost anything. It's as simple as drinking a couple of glasses of water when you're done with your sugary meal. And don't forget those B vitamins. They're super duper important. And by the way, the more water you drink, the more B vitamins you need, because when you drink water, the more water you drink, the more you eliminate that water, and with that water comes out the B vitamins in addition to the electrolytes, the potassium and the magnesium and the calcium, all of which have a beneficial and very important effect on blood sugar and also on improving the symptoms of PCOS.
You know, I have friends who are very insistent on drinking a lot of water, and I've got I'm kind of half and half on that. I see benefits to drinking water, but I also think that if you drink too much water, you can actually cause problems for yourself. You're talking about eliminating a lot of vital
good stuff.
Minerals and
all the water. That's right. All the water-soluble nutrients. That is, some of the minerals, the electrolytes particularly, potassium, calcium, magnesium, and sodium, and then also your B vitamins and vitamin C for that matter. I forgot to mention the importance of vitamin C for the adrenal glands and also for PCOS. That's another very important nutritional supplement that you could use. And your point is well taken. The more water you drink, the more you eliminate these very important water-soluble nutrients, and that's where the Beyond Tangy Tangerine can be so helpful. In fact, you know as well as I do, people get really dramatic and rapid results with the BTT, the Beyond Tangy Tangerine. It doesn't take very long. And that's because for most of us, especially if we're drinking lots of water, and many of us are drinking a lot of water, we're deficient in these vitamins and electrolytes. And as soon as you replace them in a water-soluble form, your body sucks them up really rapidly, the way a dry sponge sucks up water.
Yeah, and I remember the first time I ever took a multivitamin, and it was like it was a day and night shift for me. I think I was about 15 years old. And all of the stress and awkwardness of that age, all of a sudden I had all this self-confidence. It was a very strange, noticeable thing. Energy that I never knew I had, and then also this sort of sense of security that is a difficult thing to achieve at that age. Yeah, absolutely. And then a rebound, of course, is...
Rebound's another great one, yes.
One of my favorites after any sort of exercise or before or during...
And it doesn't have to be, a lot of times we think of exercise as being, a workout or playing basketball or playing a game of tennis, but just stress, just a hard day at work. If you're a student just studying for a test, all of these represent the kind of stress that something like Rebound FX or the Beyond Tangy Tangerine can provide tremendous benefits for.
Absolutely. I had a mother who knew when I was stressed and would actually say, you need some vitamin Bs.
Smart mom.
B6 and B12. Lucky to have had her. Well, thank you very much, Ben.